It's very sad when you carry a pregnancy in 9 months and then you end up with a dead child or yourself.
Basically around that time of delivery, that's when most mothers die. And you know the reasons why they die: hemorrhage, infection.
Tulikuwa tunapoteza wengi. Tulikuwa tunapoteza wamama, tulikuwa tunapoteza watoto.
We were just pumping magnesium sulfate in a drip, not knowing that if we do not have an infusion pump, we are doing a lot of harm to this mother.
Nilizaa mtoto hakuwa anapumua, hakuwa analia, mpaka wakamfanyia matibabu akaanza kulia.
Pregnancy brings joy and hope of parenthood to households the world over. It is perhaps the single most edifying gift for women, while childbearing is viewed as a pinnacle of community esteem for African families. That notwithstanding, however, access to progressive reproductive health services is still low in various communities where maternal and child mortality still lags.
We can have a good theatre, we can have good delivery room, but if the nurse or the health worker is incapable of offering that service, then we can still lose the mother or the baby.
The Kenyan government has made significant strides in curbing maternal and child death through partnerships with organizations such as Liverpool School of Tropical Medicine, LSTM.
We engaged the University of Nairobi, the Population and Research Institute, to conduct a study so that at least we would know where the problem is. So this study now revealed that there are 15 counties that have the highest burden of maternal mortality. And the highest county was Mandera, with 3,975,000 deaths per 100,000 life births. So the Liverpool School of Tropical Medicine is one of the partners we engaged to assist us in training of health workers in emergency obstetric care.
We're setting up a training program, an in-service training program, where we give healthcare workers the opportunity to improve their knowledge and their skills to be able to recognize and deal with obstetric and newborn care emergencies.
The Center for Maternal and Newborn Health at LSTM, an active academic unit, seeks to improve maternal and newborn health globally. LSTM is working closely with the Kenyan Ministry of Health to improve maternal and newborn health in Kenya. The 6 counties selected by UNFPA are among 15 counties in Kenya with the highest mortality ratios. These are Marsabit, Mandera, Wajir, Isiolo, Lamu and Migori.
We managed to procure equipment for almost all the health centers and hospitals in the 6 counties where we are operating. The equipment is the theater equipment, including resuscitators, incubators that save the life of the babies.
We're setting up a system whereby the county health executives and their team can train other staff as they come into post, using the mannequins, the training equipment, the resources that we leave behind.
In addition to its mandate, LSTM's commitment includes to identify, manage and prevent complications that arise during pregnancy, labor, delivery and early postpartum periods.
We've started seeing the effects of the trainings in terms of the healthcare providers being able to identify complications, being able to manage the complications and make appropriate referrals where necessary. We're also beginning to see confidence among the healthcare providers.
In Isiolo County, access to Emeret Dispensary through an unforgiving rugged terrain that sometimes cuts off communities from accessing the health center is partly to blame for the difficulties experienced by pregnant mothers and children. For Christine Alapata, delivering her baby safely in this dispensary a few months ago came as a blessing to her.
Na ukiona mtoto ameshiba, kama utakuwa nyumbani mahali ambayo kuna refrigerator, unaweza kamua hiyo maziwa, uweke kwa kibuyu ambaye ni safi, uweke kwa fridge. Kama wewe ni mtu ambaye unaenda kazi, unampatia, unamwambia mwenye ataachwa na mtoto anampatia kila baada ya masaa matatu.
Head nurse Benjamin Loripo is grateful that the training on maternal and newborn skills he received from the Liverpool School of Tropical Medicine has helped reduce referrals to higher facilities in the county, as he is able to better handle complications of childbirth.
Liverpool School of Tropical Medicine have really helped us, I can say, a great deal. Like Isiolo, the whole of Isiolo County, they have given us, I can say they have given us enough equipment with the UNFPA, and they have also given us skills.
For most women in this community, accessing maternal health care from Emirates saves them time and resources they would otherwise use to travel to far-flung district hospitals that are better established.
Kama alivyokuwa hospitali singesaidika kwa sababu mtoto alikuwa amekaribia kukuja. Sasa juu hospitali imetusaidia kwa sababu ni vizuri hata kama mtu ako hali mbaya wanasaidia ndio afike Jambo Hospital.
At the county's referral hospital, Dr. Robert Tabu is busy perusing through his patients' records at the facility's maternity admission office. Tabu is one of the beneficiary doctors who have benefited indirectly by working with trained nurses and handlers during difficult deliveries.
Even if the mother comes here and you say it would have been better if they came in earlier, there are some things that can be done in the basic facilities that are the peripheral facilities. So with the training, that knowledge was imparted to the caregivers who are found in the peripheral facility.
In the training and skills lab, nurses are gathered around for a live demonstration of pulmonary resuscitation by a trained personnel. These sessions have formed an important aspect of maternal and newborn care as they serve to save and improve the health and the well-being of women and children, thereby reducing child and maternal mortality. LSTM trained nurse Millicent Kanango, the nursing officer in charge of the Ogwevi Health Center, attends to first-time mother Helen Aoko.
We've been equipped with knowledge and skills to attend to these mothers, and from the look of our data, we can realize that the number of referral cases to the referral facility have greatly reduced because of the skills that we've gained.
Lakini nimeshakuja nilipata madaktari wa mbali walikuwa na mimi karibu. Sasa walikuwa wanasema shirikani wakanipeleka mzuri, lakini walijaribu alafu sikwenda. Nilizaa mtoto hakuwa anapumua, hakuwa analia mpaka wakamfanyia matibabu akaanza kulia. Sasa yako mzima na mimi pia niko mzima, sina shida yoyote.
If a mother comes with what we call return placenta, the healthcare provider has the skills and the equipment that is necessary to remove that retained placenta. If a mother comes with maybe unsafe abortion and is bleeding and we need to remove the products of conception, they are able to do that. If there is a difficult delivery or prolonged labor and this mother can be helped by what we call assisted vaginal delivery, then they have the equipment and the skills to do that. And this has helped reduce the numbers of referrals.
We need to know that at this level where there is a skilled person, you come to me as a skilled person. I know this is my capacity, this is what I'm meant to do, this I'm meant to refer. Okay? So once you get that system together, you have that nurse who trained in EMOC, that doctor trained on EMOC, that doctor trained in all that emergency at obstetrics, retained in the right place and at the right time and passion for that. So when you come in, we know that we can do this at this specific level, then refer. With the county system, things have helped. A number of counties now have fairly sophisticated county hospitals with support from most of our partners and ourselves and the government itself. But if you can be able to refer on timely, know what to do at the right time, then we are also good.
Kenya is set to have its first report on mortality deaths, which will inform formulation of policy and decision-making.
So the national report is going to be important because, one, it's also going to help people realize that when a woman dies, for example, and the death is being reviewed, it doesn't mean that the caretakers, the healthcare workers will be punished, but what is it that we can learn from this death and prevent further deaths?
Through LSTM, the county's referral facility is now equipped with a state-of-the-art skills training equipment for its health workers. The skills learned here with these mannequins are important life-saving techniques that have seen women deliver in healthy environments and handle more professionally. 702 kilometers southeast of Kenya's commercial capital Nairobi is the Lamu Archipelago, steeped in history and culture. The region, like many others, suffered marginalization due to centralization before the advent of devolved governance in Kenya. Mulewa notes that mobility is a unique challenge to Lamu County because it's comprised of several constituent islands of Shela, Pate and Faza. The only mode of transport here is by boat, which sometimes hampers delays in referrals of emergency cases to the main health facility, which could be 4 hours away in some instances. Mulewa notes that despite these challenges, there has been a significant reduction of maternal deaths.
So 65% of our mothers in Lamu County are now delivering in the hands of a skilled personnel, meaning they are delivering in our health facilities. Right? We have improved the facilities, we have equipment, we have staff.
Witu Health Center, located in the mainland with a catchment area of 14,000 people, mainly from the nomadic tribes of the Orma and Wardei, is a great success despite operating in a harsh environment prone to terror attacks due to its proximity to the Kenya-Somalia border. Due to the low literacy levels in the area, language barriers are a common challenge, with most personnel enlisting the help of interpreters to communicate with patients. Religious and cultural beliefs have also seen a lot of women shun skilled deliveries. The intervention of community health workers has seen a change in perception. Madina Barasa is a mother of an 18-month-old baby. She discontinued education shortly after completing her primary school studies and opted for early marriage, a common practice in this region. She attributes her safe delivery despite her complications to well-trained health workers who are beneficiaries of the EMOG program.
Those cases which we are taking them for referrals, it was not cost effective because we use our time, energy and fuel. But right now there are some cases which we used when we saw them, we said this is for referral, but right now we can manage it here just in our facility.
Before we got these trainings, we used to lose mothers to obstetric hemorrhage. People never knew, there was misdiagnosis as to why that mother is bleeding. For example, somebody would go thinking of uterine atony, or maybe it is a cervical tear. But when we went for that training, now we are able to have the correct diagnosis, whether it is tear, thrombin, it is the atony, or it is the tissue that is remaining of the POCs in the uterus. So I can say that the death rate has gone down. Even the neonatal deaths have reduced because now we have skills. Like the neonatal resuscitation, we are really behind. We used to rush even into drugs, but we came to know that drugs, they are in advanced level, that is the advanced life support. But with the EMOC, it's just the symbol ABC. So we just do bagging and we support by oxygen, and the neonate comes up.
Mulewa says the training has breached a critical training skills gap that is not provided for in schools of health sciences in Kenya. The common thread in the testimonials from the 3 different counties that have benefited from the programs and interventions have not just been an expenditure, but an investment.
And LSTM will be working with the Ministry of Health to make sure that we put in a system in place to make it mandatory that healthcare workers providing maternity care can have this well-needed training to improve their capacity to provide timely, life-saving and critical care.
So let's get ourselves to be able to reduce maternal mortality so that childbirth is fun for everybody. I mean, it's a right. Everybody should be able to deliver, get their children at the right time.
With funding from UNFPA for the 6 counties, LSTM targets facilities with less than 100 deliveries per quarter.
We are so happy with the implementation of this project to the extent that we are also engaging various development partners to see if they can continue to support this initiative.
LSTM is cognizant of the facilitation role that UNFPA has played in making these interventions a great success.